Thank you, Dr. Stavanovich and Dr. Sakara. That was great. My name is Brian Newcomb. I'm a physical therapist at Plymouth Bay, and my talk's going to be on shoe designing, running biomechanics. So before I jump into it, I just want to have a quick show of hands. How many of you either run or walk? And do all of you do that for some sort of physical activity or exercise? Okay, good. So I think this will hopefully hit home on some points for everyone in here. So, all right, so I just want to give you a little bit of background. 85% of people who run for recreation will incur an injury over a 20-month period. And this high prevalence of running injury has led to a big interest in running biomechanics and looking at footwear parameters. There's an even higher prevalence in the female population. You're twice as likely to experience patellofemoral pain, and females who run 5K and 10Ks are likely to have lower leg injuries. So I just wanted to point out this statistic at the bottom here. If you run 1 mile, your foot is striking the ground 1,000 times. If you run 20 miles per week, which is, it's a good amount of mileage, but pretty low for some runners, that's 1 million foot strikes per year. And as one of my colleagues pointed out, if you have short legs, it's even more foot strikes. So, and then I want to go back in history a little bit. These are some cave paintings from South Africa, dated about 2,400 years ago. And back then, our main purpose of running was for food. We'd chase our food. That was our main reason. Now, we run for sport, and we get our food at the supermarket or a restaurant. So these right here are some of the earliest pairs of shoes, dated back 10,000 years. These were found in a cave in Fort Rock, Oregon. These were most likely worn to protect the bottom of the feet while walking, not for running. And then you have early sneakers. These are Keds. Most people have probably seen these. These were the first sneakers. And then on the right, this is an early track shoe from Reebok. And then later on, Adidas ended up customizing the spikes on the bottom of the shoes. So again, here's the Keds. And then in the pre-1960s, there was no cushioning, there was no heel drop, and I'll explain more of what that is as we go, but it's kind of interesting to see what these old shoes looked like. Then in the 1970s, you had your first running shoes, the Nike Cortez on the right, or your right, yes. And those were all cushioned, and the thought was to reduce injury. And since then, there's been 3 different types of shoes. You've got on the top a neutral shoe. In the middle, you've got a more cushioned shoe, which is a fresh foam from New Balance. The top is a Nike Pegasus. On the bottom is another New Balance shoe that's built for stability. And I'm going to get in a little bit more detail about that, but I want to point out the heel drop there. That is the difference in height from the heel down to the toe. So this is kind of an important thing that I wanted to point out. So we're going to look at the anatomy of a running shoe here. We can break it down to your forefoot, your midfoot, and the heel. And then this, not all shoes have this, but a lot of running shoes will have a hardened shank in the middle there. And what that does is it limits the rotational play in the shoe. So it's more motion control, less motion between your forefoot and your rear foot. And then you've got the upper portion of your shoe. And then you have what's called a heel counter. This is also a rigid piece that goes into the shoe. It's meant to hold the rear foot and prevent rear foot motion. I did want to point out that most maximal shoes, so those are the highly cushioned shoes, have less than 6 millimeters of drop from the heel to the toe. There's not a lot of data out there on how this actually affects your running biomechanics. So we'll look at a shoe dissection. This is a great cross section of a shoe. You've got the outsole, which is the part that contacts the ground. You've got the midsole, that's between your foot and the insole here. And then you've got the toe box. Are some of these sounding familiar to you guys that have shopped for running shoes or any walking shoe? And then again, you can see a nice depiction of the heel offset there, the drop. So I want to look at the risk factors. So this graph here shows vertical ground reaction forces. So going back to kind of basic biomechanics, physics, for every action, there's an equal and opposite reaction. So your foot strikes the ground, there's going to be an equal force coming directly in the same vector back up towards your body, towards all of your joints. So I do want to point out on the side here, this is the slope of the line, and that top impact peak, that is really one of the variables of interest that we'll be looking at here. Also the vertical loading rate, that is the amount of body weights over time that will be the force going through your foot. And then ankle eversion is another interesting variable here. So again, I want to highlight the figure with the impact piece, the impact peak, excuse me. Again, we're looking at loading rate and impact peak. So those have been found in multiple biomechanical studies to lead to increased injury in runners. So those two things, the impact peak loading rate, and then leg stiffness as well. So you have to think of the lower extremity as a spring. When your foot strikes the ground, you're loading the spring up. When you go for that push off, the spring's unloading. There's a few characteristics that are thought to influence the ground reaction force. So your foot surface area is one of them. That's really meant to attenuate the impact forces using the medial and longitudinal arch of the foot and also the Achilles tendon. And then we already kind of touched base on the spring, so I'll move on. I did want to touch on this quickly because a lot of people have been getting into a shoe that has absolutely zero drop. So you can see the shoe on the left has no change from the heel height to the toe height versus this one here. There's been some longitudinal studies that compared low drop versus other shoes, and they found that there was an increase in injury rate in some of those. That's very preliminary. There's probably more research that needs to be done on that. So we kind of touched on that. So the low drop shoe, it has increased ground reaction forces, increased loading rate, it increases your leg stiffness, and then again shown to show some increased injury rate. So I just want to point out a few studies that I was a part of when I was a research assistant. Just a disclaimer, I am not the main authors of any of these studies, but I did assist in the data collection and the statistical analysis of it. So our first question was, are there differences in running biomechanics between maximal and traditional shoes? And so this first study, we had 15 runners, and you'd be surprised at how hard it is to find people who want to be part of a running study. We had to bribe them with gift cards and things like that. So we had 15 runners. We had a couple different Hoka shoes. Is everyone familiar with Hoka? It's been kind of a big brand out there. Okay, good. And then we compared that to just a traditional New Balance shoe. So the participants would come into the lab. They'd have 2 bouts of running before and after a 5K on the treadmill. And our hypothesis was maximal shoes would lower the impact peak and the loading rate. So the idea is the more cushion, the less injury, right? It's going to protect you more. And it's taking a second. I'm not sure if that's the animation doing this or not. Oh, there we go. Thanks, you fixed it. Okay, so we're going to look at a couple graphs here. This is the loading rate. So on the left in the gray, you have your traditional shoe, and on the right, you have your maximal shoe. So you can see in both instances, the loading rate before a 5K run on the treadmill was higher in the maximal shoe, and even after, it was higher in the maximal shoe. The impact peak as well was statistically significant, higher than the traditional shoe. And then we also looked at peak eversion, which you can see there's no difference statistically there. So the summary is there's been elevated impact forces, loading rates in the maximal shoe, which may increase risk of injury. And these were not mitigated at all after a warm-up of any kind. So you're not getting used to the shoe as you run more. And then this was published in the OJSM, Orthopedic Journal of Sports Medicine. Okay, so let's do another study. We want to know, are the runners going to adapt to mitigate these impact forces if they're given a longer acclimation period? So this study, we had 28 runners. We had an updated version of the Hoka Bondi 5. We had the same traditional running shoe. So this was 2 visits, 6 weeks apart, and then they would do 2 bouts of running when they first showed up, and then 6 weeks later after they had gradually increased their mileage 20% week over week in the Hoka shoe. And then again, our hypothesis would be that these injury risk factors, these biomechanical risk factors, would significantly decrease if they had more of an acclimation. And we're waiting again. Oh, there we go. All right, so again, loading rate, you can see in the orange, loading rate still significantly higher at the initial visit and then also 6 weeks after acclimating to the shoe. Impact peak, again, significantly higher both initially and 6 weeks later. This is a wonderful graph of stance phase. This is 0% to 100% of your stance phase. This line here is showing the ankle eversion. Now, during a normal gait cycle, you're going to start in a little bit of inversion. You'll move into that eversion as you get through the stance, and then you roll back off of the foot with some supination and back into inversion. That's kind of the spring mechanism of the foot. But this solid line here is the maximal shoe, which you can see they never left eversion in the Hoka shoe. The entire stance phase, your ankle's in eversion, which is a known risk factor for injury. So a 6-week transition did not change running biomechanics. There were elevated impact forces, loading rates, and prolonged eversion, and all 3 of these factors are factors for increased injury. This ended up being published in the American Journal of Sports Medicine. Okay, so the third study, will we observe the same results if we more closely control the cushioning of the shoe? So this was actually 20 runners with a New Balance fresh foam and then custom-made maximal and minimal shoes. So we're looking at 3 different shoes here. 1 lab visit, they ran 3 times, and we were looking to see, would we observe the same results for the ground reaction forces and ankle kinematics as we found previously in the last 2 studies? And those are the shoes we used right there. So this is loading rate. We're looking at traditional in blue, maximal shoe in orange, and your minimal shoe here in gray. So you can see a higher loading rate in the minimal shoe. Impact peak, no real statistical difference. And then this is also ankle eversion, and you can see in the orange, we've got our maximal shoe, which once again, never left ankle eversion the entire time your foot is in contact with the ground. So after directly manipulating the cushioning, we didn't see any differences in the impact forces or loading rates between the maximal and traditional shoes. I think it's probably fairly safe to assume that most of you know the minimal shoes out there. Do you remember the Vibram 5-finger shoes, that whole fad, barefoot running? We know that people were getting injured after wearing those shoes, trying to change running into those. So we know there's higher loading rates in those shoes compared to the others. And then, of course, the runners still displayed prolonged eversion in the maximal shoe. And this was a little bit smaller journal, Journal of Science and Medicine and Sport. I do not want to gloss over walking because a lot of people, especially the aging population, are walking for their exercise. This was 16 females, ages 50 to 70. We've got, again, 3 different types of shoes. We've got the Hoka, our maximal shoe. We've got a regular New Balance traditional shoe and a Merrell minimal shoe. And this was just one lab visit walking in each type of those shoes. And again, our hope was that the maximal shoe would decrease the ground reaction forces and decrease lateral joint forces at the knee. So there's our shoes there. Everyone's familiar with these, right? We've all seen those. Okay, lateral force at the knee. You can see in the maximal shoe, there were higher lateral forces, which is actually correlated to an increased rate of disease progression in knee osteoarthritis. So all of you therapists out there who have patients with knee arthritis and they swear by the Hoka shoes, let's give it a few years and see what happens. All right, so the big question is so what should people do? Not just runners, but anybody who wants to walk or run for physical activity or exercise. This was published. Cushion shoes are all the rage, but they aren't foolproof. So in conclusion, the medical literature really points to self-selection of your shoe as the best criteria when selecting a running shoe. So I know that's a little anticlimactic, but the answer is, what's the best shoe? It's the shoe that fits. It's the shoe that feels good. Use the shoe that feels best on your feet. And that would be, my suggestion to my patients, because I get that question a lot. What's the best shoe? And obviously you can do, foot posture. You can look at foot posture. You can do a gait analysis and try to make your best assessment. But there's only so much you can see with the naked eye. So that's what I end up defaulting to is find a shoe that works. If it's not causing you increased pain in any of your lower extremity, your foot, ankle, knee, hip, low back, then that's going to be the shoe for you. Okay. Thank you.